Hello friends, I am Dr. Prashant Sharma and you're watching Medicos Hub 2. This is a series of lectures on neuromuscular blocking agents and I am going to discuss the comparison between the non-depolarizing and the depolarizing blockers. In normal conditions, this is the synaptic button or end of the neuron participating in the neuromuscular junction, and this is the motor end plate having the acetylcholine receptors. These acetylcholine receptors are made up of 5 subunits, and these are also having a sodium channel within. So normally when acetylcholine binds with these two sites, these are two alpha subunits and these are having binding sites for acetylcholine. So each acetylcholine receptor is having two binding sites for two molecules of acetylcholine each. Then these molecules will bind to the acetylcholine binding sites on these acetylcholine receptors and will result in the opening of sodium channel that will finally result in depolarization of the motor end plate. Now, what is the mechanism of working of non-depolarizing blockers? These non-depolarizing blockers compete with acetylcholine, will bind to the acetylcholine binding sites on alpha subunits of acetylcholine receptor, but will not result in opening of sodium channel. That's why this motor end plate will not be depolarized. That's why these are known as non-depolarizing blockers. So mechanism is that these blockers will bind to acetylcholine binding sites on acetylcholine receptors, but sodium channel will not be opening. So no end plate potential and so no muscle action potential. Now, what is the mechanism of depolarizing blockers? If depolarizing blockers will act, then the initial mechanism is same, that these blockers will bind to the alpha subunits of the acetylcholine receptor, and there is a difference, and these will also result in opening of sodium channel. That is, these are having the biological property of acetylcholine, but because these will remain binding with the acetylcholine binding sites on the acetylcholine receptor, so it will result in a consistent depolarization, and already depolarized membrane or muscle end plate will not respond to the further action potentials and will result in a blockade. So depolarizing blockers these blockers bind to acetylcholine binding sites on AChR and also open the sodium channels. Because of this, membrane becomes depolarized and will not respond to next or further action potentials, because these blockers are not having any enzyme which will hydrolyze them. For example, acetylcholine esterase will hydrolyze the acetylcholine, but these blockers are not having any type of hydrolyzing enzymes in the synaptic cleft, so they will remain there for a longer time and they will not respond to next action potential. Now, which type of paralysis is produced in man when neuromuscular blocking agents of non-depolarizing or competitive type come in action? As soon as IV is given, rapid muscle weakness is there, followed by flaccid paralysis. Here IV will produce more rapid response in the form of fasciculations. Final result is same. After few seconds, flaccid paralysis will be there. Human neonates are more sensitive to non-depolarizing blockers, while these are relatively resistant to depolarizing blockers. If paralysis in chick is discussed, non-depolarizing blockers cause flaccid paralysis. Here, the depolarizing blockers will result in spastic paralysis. What is the effect on isolated frog rectus muscle? No contraction is there. Here the contraction can be observed. Species sensitivity, if discussed, then in case of non-depolarizing blockers, most sensitive is rat, then rabbit, then cat. This sequence is reversed in case of depolarizing blockers: cat, then rabbit, then rat. Effect of neostigmine: it antagonizes the block. In this case, there will be no effect. Sometimes it may potentiate even. Tetanic stimulation during partial block, if done, then it will result in weak sustained contraction, while the depolarizing blockers, if given, then they will result in sustained, well sustained contraction. In case of non-depolarizing blockers, post-tetanic potentiation is present, while here post-tetanic potentiation is absent. In next video, we'll discuss some more differences in the examples of non-depolarizing and depolarizing blockers. Hit the like button, share and subscribe our channel to get the latest updates and notifications.